Today on Staying Relevant, we're joined by someone who knows what it means to evolve at the highest level. Kelsey Serwa is an Olympic gold medalist and former world champion in ski cross. Someone who competed on the biggest stage in sport and stood on top of the podium for Canada. But what's fascinating isn't just what she accomplished in competition, it's what she chose to do next. Kelsey transitioned from elite athlete to physiotherapist, while also becoming a parent, stepping into sports commentary, and rebuilding her identity outside of professional sport. In today's conversation, we're diving into what it's really like to go from world-class performer to new clinician, the confidence gap, managing expectations, dealing with burnout, balancing empathy with accountability, and what resilience from sport teaches you about helping others to heal. This is a conversation about reinvention, systems thinking, mentorship, and what it truly means to stay relevant in your next chapter. Ladies and gentlemen, Kelsey Serwa.
The World Cup races for CBC now and broadcasting Olympics, people are like, do you miss it? And I'm like, nope, not at all. Like, is you have these high expectations for yourself in sport, and that doesn't stop when you exit sport. It carries on with you. It's a part of your personality. Commentating for ski cross World Cup races and the Olympics is tons of fun. And the part I love most about it,
Ladies and gentlemen, Kelsey Serwa. Thanks for joining us, Kelsey. Kelsey? Blah, blah, blah.
Thanks for having me, Tom.
So, when you retired as an Olympic champion, who were you without ski cross?
Still Kelsey, which was good. Yeah, thanks. I used injuries in sport, in competition, as an opportunity to continuously chip away at my education. I always knew that I wanted to go into physio. I knew that I had to get an undergrad before I could get into a master's program in Canada. And so that's how I approached it. So I think when I retired from sport, one, I was very fortunate in that I got to choose my timing, my exit from my sport. In 2018, I won the Olympics, and then I decided to do like a victory lap per se, one more season competing World Cup level for ski cross. And then at the end of that season, I was like, yep, I've done everything that I wanted to do in sport. I'm really happy with where things left off. I was well supported. It was a smooth transition out of it, and I dropped straight into school full time. But again, because I had prepared myself, I had started to chip away at my post-secondary education over the previous 10 years, that it wasn't as daunting as a transition as I know what a lot of athletes retiring from elite competition experience. So I was well prepared in that way. The other fun transition is that I actually signed up to be an athletic trainer, like a student athletic trainer for our varsity women's soccer team. Yep. And I know you have a soccer background too. Yep. But that was a really cool first experience for me, being on the, I guess, kind of treating end, very preliminary, right? A couple ankle taping techniques and guiding dynamic warm-ups and stuff like that. But yeah, my first like intro into like, okay, this is what it's like to be on the other side of sport, which was really cool.
Was there a bit of a grieving period at all, or did you find that, was it very long, or was there one at all?
I was lucky I didn't have this grieving period, and I think it's because I knew what I wanted to do. I had set myself up well for it, prepared for it, and then I kept myself busy. I knew that like my summer vacation, per se, after I retired from sport was going to be kind of my last summer off, so I was just like invested in doing as many fun things as I could, working as front desk in the physio clinic that I'm now working now as a physio. And yeah, getting some reps in on that side of things. And so, yeah, I was fortunate to not have this grieving period.
Was there anything that surprised you the most about stepping away from sport?
Everyone always asks me, and this is going back to that grieving period that you just asked about, is like, do you regret not being there? And even I'm doing some commentary work for the World Cup races for CBC now and broadcasting Olympics. People are like, do you miss it? And I'm like, nope, not at all. Like, I'm happy that, that chapter in my life is kind of closed and has evolved into what I'm doing now. I think my body was ready. I've gone through a number of injuries, and and I was still thinking about future, what do I want my future in athletic engagement to look like? And so, yeah, I was ready. There was no grieving, no sense of loss.
Any
I was ready for
pressure
it.
about capitalizing on, your relevance in the sport early on or ongoing?
Good question. It's funny because I think as a student, and this is more of an internal pressure than anything, is you have these high expectations for yourself in sport, and that doesn't stop when you exit sport. It carries on with you. It's a part of your personality, that identity. So I was maintaining that, but then I also thought that other people had that expectation of me as well, to like be an Olympic gold medalist in school. And sure enough, I like achieved that in the sense, like top of my class, and did my best work where I could, putting that in. But yeah, I'd say that was kind of the only expectation, is like greatness all around, which is daunting, but also a good motivator.
Yeah. Well, did a lot of your classmates know who you are coming in?
Everybody. Yeah, it's so funny.
No
It,
pressure.
yeah, it was myself and another Canadian Olympian, Kelsey who
Oh, yeah.
competed in 2014 in ski halfpipe.
Oh,
And
awesome.
we both got into the program at the same year. So we were there, the classes like resident Olympians, which was cute. Um, and were kindly referred to in such way. And yeah, so people knew.
What's the hardest part about being a new physio?
The hardest part for me about being a new physio, and again, this goes back from over a decade of competing at the highest level in sport, at Olympic level, and being really proficient at your craft and knowing the ins and outs of it, knowing exactly what you need, knowing how to tweak each day, that positive self-talk, that mindset, that focus, the physical prep, and then to transition into a new career where you're like, oh crap, I'm a beginner again. Like I gotta relearn everything. Yes, there's transferable skills in there, but confidence comes with experience. And when you're lacking that experience, it's a lot of work to fake confidence.
Yeah, that's so true. And new grads going straight from high school to undergrad to physio and then into real world, we see coming out, it is that lack of confidence. And it's because of it's a lack of experience, even just in life and some of those transferable skills. And you had such a lot of life lessons, growing up and going in as a more mature student, really. And you've been able to carry that. So, and people see that, you get a client comes in, patient comes in, I'm in pain. Oh, you're an Olympian. There's that expectation of, oh, I'm being treated by a gold medalist, right? Which helps give confidence of them in you. But if you're carrying that confidence already because of just past experience, regardless of where your confidence came from, not necessarily in the realm of physio, but being in the process and on the other end, I guess that would create a greater connection with the clients that come in because you've been injured, you know the rehab process. Now you have that level of empathy. Do you feel that's one of your superpowers?
The empathy piece, yeah, having experienced injuries myself and knowing what it feels like to be like in a world where you didn't really have to consider anything, and now every movement that you feel, you're thinking about this injury, or like, am I going to get back to 100%? Am I going to get back to the things that I love? So in that sense, yeah, I have the empathy for sure. I also maybe lack empathy in clients that show up and expect us as a therapist to perform all the work and not being met halfway.
Right.
It's like we can do what we can in a clinical setting, but 98% of the work is going to come from outside, right? Them putting in that time and that work. But also, yeah, it's like injuries suck. It's hard to go through. It affects your work, how you show up with your family, your extracurricular activities. And I think too, like aside from being an athlete and being mom, I know how precious time is now.
Yeah.
And being able to like, okay, in a perfect world, these are all the exercises that I would have you do in this setting. However, I know that you have snippets of like 5 minutes at a time and you're running on 4 or 5 hours of broken sleep. Like, let's find the balance here, right?
Is it empathy or is it a lack of patience?
It depends on who's in front of you and,
Sure.
and what they're doing, I think. Yeah. I think it can transition into lack of patience if they're like, yep, I don't do my exercises, there's no progress going on, and then that weight gets shifted on you as the therapist being like, look, why am I not getting better? I mean, fortunately for us, as you know, time is always on our side, right? Natural progression is helpful, but also, yeah.
It's also reframing the expectations and educating the client of the relationship that you have now established. It's not, show up and fix me. It's we're going to do this together, and you have to be their guide. You got to be their guide and their coach in the process. Of like, yep, this is hard. We're going to do this together. As long as you put in the work, I'm happy to put in the work. So let's work on this together. Do you find that there are higher expectations from clients coming in and knowing your background of them, getting the best care, but also, I'm seeing an Olympic medalist and they're my therapist. So
It's funny because I was like, when I was submitting my bio for the clinic's webpage, went through this bit of dilemma. I'm like, do I include this in my bio or don't I? Like, is it going to help me see more clients? Perhaps. Is it going to affect the expectations?
yep.
Perhaps. Is it going to get people to trust me quicker? Perhaps. So I decided to like, yeah, let's talk about this. So then there's not this like weird awkward moment of like, hey, why is that your poster that I see on the wall in this room that I'm being treated?
What's that gold medal around your neck?
Yeah. So I went for it, and yeah, perhaps that maybe there's some expectation coming in, and my aspiration is that I live up to that expectation, and that my strengths are in seeing how people move, what capacity they need to move in for, I guess, their jobs and for their recreational activities where they're experiencing those restrictions, limitations. And then because in sport, we spend the majority of our time actually in the gym rather than on the ski hill, tons of gym experience. And like, I love the creativity of like pulling exercises in. I'm like, oh, that movement doesn't feel good for you. Let's try and modify it in this way.
Yeah.
You know what I mean? So, yeah, I hope I'm living up to people's expectations.
Well, it's great for marketing. I mean, because we worked together for a few years with Alpine in Canada, and when I retired, putting that on your bio that, oh, you were a physio and assistant strength coach with the Olympic ski team, it's good for marketing, but I don't mind the pressure. I like the pressure, if you give me pressure, you put me in a high pressure situation, I'm like, yeah, let's do this.
In sport,
yeah, it's the same as in sport.
no, totally. And like, I would use that as like, this pressure is a privilege, right? There's a reason why this pressure is here. It's because you've earned it. And truly, you have.
That's a good way to put it. I like that. Does the imposter syndrome ever slip in?
Oh, yeah.
Yeah.
It's funny because I really dislike that term, imposter syndrome. I don't know what, maybe it's too like it's trendy.
It's like during COVID, we're going to pivot. Everyone pivots. I get it. Making adjustments on the fly. And it became that cliche term that everyone just jumps on. But I mean, we use words to help describe something. And if everybody knows what that definition
it's
means,
easier.
or we can define something rather than a paragraph, we can use a word for it. But,
Totally.
it does slip away. And then even for as long as I've been doing this, sometimes I'll be like, am I full of shit sometimes? But I'm like, well, they got better. And then I'll always question myself. I'm like, what did I say? Was that right? And I'll go, no, okay, it was. Because sometimes we can get caught in repeating things because we've repeated so much, it becomes truth. So, if you have that self-awareness and you're making changes and you're saying and doing things that are creating change to a level of accuracy and truth, at the end of the day, results are the only thing that matters.
And I think too, Tom, that self-reflection piece, and you always questioning yourself, am I doing the best that I can for this client? That's a sign of a good physio, right? That's somebody that wants to like continually progress and be better and work all the ins and outs and like double check, am I missing something? Like, can I talk to someone about this? Can I pick their brain? And that's true across the board in any profession, right? So, and I know too, it's a lot easier for our brains to focus on what we're missing, like our negatives, like our faults, rather than like leaning into our strengths and celebrating those, right? It's the analogies in sport are so easy, right? You win maybe like 1 out of 100 races kind of thing. So there's a lot more failure that happens between that like ultimate triumph. The triumph feels good, but the learning happens in the spaces in between.
Yeah, all the time. All the failures, all the setbacks, all the self-doubt. But we do it because we care. We do it, we question ourselves, we doubt ourselves because we want to put the best product out there. We want to do the best for the people that are counting on us to show up. And, that's, again, in a sport, whether it's a team sport, individual sport, your team, your country, whatever, they're depending on you. And if the people are depending on you and the expectation is that, you want to put the best foot forward and make sure that if you know you've done your best, then it's like, okay, I didn't win, but I know I put my 100% in. And I mean, there's no worse feeling than, I could have done better. I wish I did this, right? And that's preparation. How's parenting? You're a new mom. How old's the little one?
She is 1.5 years.
Yeah. How are you juggling things? How's that, throwing that into the mix of things?
Yeah, it depends on the day. It was funny because I was about to put like a dirty plate in the cupboard where food goes just before our call here. And I was like, well, I'm looking for the dishwasher, not like the pantry. So it shows up different on different days based on sleep, activity, general like teeth coming in, exposure to germs, all that fun stuff.
Yeah.
But no, it's good. It's been a fun challenge. Their balance is tricky, and I think it's pretty standard across the board for new parents, but it's a lot of like giving, right? We're always giving. We're making sure like baby's managed, work is managed, clients are managed, partner relationship is managed and balanced. And then there's our poor dog that he's like, hey, I haven't been fed yet today. Or it's like, I've been fed like 3 times today because you guys forgot. And you just keep feeding me. But yeah, no, I mean, it's a work in progress. It's not pretty. It's far from perfect. But it's a fun journey to be on for sure.
How are you finding balance for yourself to do the things that you need to keep your cup full? Because you just mentioned give, but as a new mom and the pressure of that and the responsibilities, and how are you finding time to balance what you need?
Yeah, still figuring that part out, still seeking that out for sure. Yeah, it's a work in progress without much progress for now. Okay. But winter is like mega busy for me. I haven't said yes to things that I typically have said yes to. So I think like managing the workload. I live in Whistler, so it's funny, you talk to the average person, they got like 4 different jobs on the go. And I feel the same. Yeah. So it's just like, okay, what's core, what's key, what's, like you said, adding to the cup rather than taking away from the system. And can we make this push for a short term during these winter months where we can capitalize on it and then set ourselves up for a more mellow kind of shoulder season, summer season. I think that's the vision, that's the goal. But it's funny too, because you always are like, okay, once I just get through this, then I'll chill, then I'll look after myself, then I'll get back into the gym and pursue that course that I was, been wanting to do. But that next thing always comes up, right? So it's like you can't always just wait for the opportune moment. You just have to throw yourself in sometimes. But not too much.
No.
It's like, No, it's such an art, but yeah, it's trial and error, but we're alive and doing well, I'd say.
That's awesome. Now, your strength being in the movement performance side of things, you do a lot of work safe, the gym setting. Talk to everybody a little bit about that in
All
with that
right.
part of your rehab practice.
Totally. So I think this is where I'm finding balance and where I'm finding confidence as being a new therapist is leaning into something that I'm good at, and that's like exercise prescription, exercise rehab. So what we're doing is out of the Whistler Mountain Ski Club, they have a beautiful like private gym facility. We got a lot of like free weights, bars, Olympic lifting platforms, space to move in this quiet setting until we turn the music up, of course. But basically, somebody gets injured at work. They've kind of gone as far as they can in a clinical setting where they've kind of plateaued, but they're still not back at work full time. So then they get referred to us in this occupational rehab program where we get them from 6 to 9 weeks, 3 hours a day, 5 days a week. So now they're getting compensated by WorkSafe to essentially be an elite athlete.
Yeah.
And an incredible opportunity for the worker, but also for myself as a therapist, a new grad, because these people come in, they've already been through the rounds of their initial assessments, their diagnostics, they've seen ortho if they need to. So they come in with a diagnosis, and then I get to do my initial assessment on them. So it's almost me like reconfirming, okay, what have other people seen versus what have I seen? Especially, I like reading the ortho reports because I'm like, okay, what are their special tests that they're doing? Can I recreate it? Can I have the same findings? And then to work with these people for 3 hours at a time, like that is unheard of. We don't get that in physio. Most clinics here are 30-minute appointments. I feel like I'm in an anomaly at 45 minutes for definitely for initials, and then my follow-ups I try and do 45 as well.
Yeah.
But yeah, so a great opportunity to like, okay, what are the work demands of this person? Where are they at now? Let's bridge the gap between that. Let's get them moving, loading, lifting, rotating, build up the capacity of the system.
That's I've seen. I used to work at a clinic when I was younger, and they had what's called a work hardening. Same idea, but it would be in the clinic, and they would basically be filling cart whatever their job was. And oftentimes it's factory or whatever, so they have to repeat. They have to build up that capacity for their thing. But you've got access to dumbbells, barbells. It's like it sounds like yeah, you get to train them like athletes, which in turn, if you can get their strength capacity well above what their job demands, then when they go back to the job, it's going to be so much easier. And people don't understand that. I'd watch them and they would only lift, push, and pull exactly the weight that they have to do for their job. And they would do that for hours on end. I'm like, this is not doing anything. Like, if anything, you're building up to a threshold, but if their intensity or volume goes up, they're going to crash and burn. And if you have
Totally.
access to significantly heavier weights and teach them how to be so efficient with pushing and pulling heavier things, when they go back to the job, it's so much easier. And that's where we don't, in physio school, it's been a long time since I graduated, the amount of weights that they would tell us to get, bands, 5-pound dumbbells, I'm like, yeah, but you got to deadlift. You got to carry heavy stuff. You got to squat. You got to go up and down stairs with loads.
Yeah,
And
exactly.
great environment. And how excited are your patients to go and be like, I get to train like an athlete for 3 hours a day. This is awesome.
Totally. And get trained by Olympic gold medalists?
Yeah.
No, it's so cool. And like 99% of the people are so pumped to be there and appreciate it. And the feedback that we get is like, this is the strongest that I've ever been.
Right.
Yeah. And a lot of the people that come into our program have elite jobs. They're ski patrol, they're bike patrol, they're instructors, right? Ski instructors, bike instructors. Yeah, they get after it. And
So they
so
love their job too, so that helps.
that does help. Yeah,
Yeah.
there's a lot of buy-in there. But then we also get the people that come in and been dealing with chronic back pain, and so we get an opportunity to actually go through some pain neuroscience education with them, right? And in more than these like 5-minute snippets of education that you would get in a clinical setting, I guess. So to have that repeatedly and to check in. And also the other thing that I love is like, how does what we did yesterday impact how you're feeling today? Because that's the other thing that I'm really self-aware of is physio is expensive. A lot of people don't have insurance. And yeah, maybe it would be ultimate scenario to have someone come in a couple times a week. Like, who can afford that? Yeah. Plus, I don't work multiple times a week anyway, so that's an easy way for me to navigate that. But in a clinical setting. But anyway, so I get this opportunity with them in the gym setting. Is like, where are you at? Do we need to modify? Do we keep teasing this pain? Stuff like that. So I love the format of that gym setting, exercise rehab. It's very cool.
How do you work around the individuals who may have a little bit of apprehension or fear about lifting up something relatively heavy because I've had this chronic low back pain? It's become a part of their identity. How do you work around those individuals to get them their confidence back and get them moving in the right direction and not limit, using their psychology and not self-limiting themselves and these belief systems? What's your strategy around that?
Yeah, good on that. I think one, you got to start small and progressively increase, and then point out those positive changes that they've made. Celebrate those small successes. It's the same when I was coming back to sport after injury. We don't go and just out of the blue hit this 70, 80-foot jump. We're going to start with like a 5-footer and make sure that you feel nice and balanced and comfortable in the air. And then we're going to build up the height and the distance and the demands, right? And I think that's the same with people feeling confident in their bodies again, is like provide the evidence, do it like you say, like make sure the nervous system feels safe and relaxed so it'll allow us to get in there. And then slowly progress the load of it. So whether that's playing with gravity by changing body position, using bands for support rather than resistance, and then progressing to dumbbells, an external load that way. Yeah, I think everything can be done in a stepwise pattern. And then some people just need more reassurance that this is safe. You're not going to make yourself worse. The pain neuroscience education piece of like, just because there is pain here, it doesn't necessarily mean that damage is being done, right? So yeah, it's a lot of talking and almost negotiating with the person and with their nervous system.
Totally. Do you see rehab differently because you've gone through injury yourself? Do you feel like you see injury and rehab differently? Then
I think, yeah.
Like some physios, they played sports growing up, but they may not have had severe injury growing up that they've had to battle back from.
Yeah, I think it definitely is a strength as being the treating therapist to have experienced what it's like to be on the receiving end of the table, to go through those injuries, and what it means to like go through all of the work to get back to where you want to be. And I know, Tom, you can speak firsthand about this with the comeback that you made, of course, right? And yeah, and it's nice to be able to relate to people, and you're like, hey, I understand what you're experiencing, and the mental side as well. I'm like, this is frustrating, I've been there before, this is what has helped me, maybe it can help you. Yeah.
What frustrates you most in rehab?
I think it's the part that either people not wanting or willing or really grasping the importance of putting in the work there, or I guess on the opposite end of the spectrum, and this is almost what we see more here, is people pushing too hard to get back without the progressive increase in loading. So like we have a lot of people that are like, all right, I'm 9 months post ACL surgery. Everyone goes back to skiing at that time. Here we
That's what
go.
the paper says, right?
Totally, totally. Or like, can I go back at 6 months because this Olympic athlete did it? And I'm like, yeah, I mean, like, ideally
We're,
no, but
I mean, athletes have different resources. When you
and
get
different
injured,
timelines.
and it's a different timeline. And your job as an athlete is to get better. I mean, at COP, when Kent was in the clinic with you guys, not you at that time, but with like Jan, I think he was working with Jan, and or shoot, Kachera, and he was there from 9 a.m. to 11, rehab, training, lunch, back in from 1 to 3, a break, and then again. So like 3 2-hour sessions in a day.
Yeah.
But
Yeah.
I mean, your full-time job is an athlete. And if you're not doing your sport, your job is now rehab. But people don't understand that, yeah, the athlete gets back faster because they're doing 10 times more rehab in that time.
And the other thing too is that no matter how much rehab you do, it's not going to change the healing time
No.
of the ligament,
Yep.
right? That'll still take
Yep.
as long as it
6 months.
takes.
Yep. As long as it takes.
Yeah, no,
And if you got other
exactly.
resources and special modalities, and now, all the medical stuff, injections, PRP,
Yeah.
there are things that can help accelerate it. And clients will be, well, I saw Gally and he did, PRP on my groin muscle and it's 100%. Well, is it? I mean, the tear might be healed, but the connective tissue still needs to be strengthened. Like that's still going to take some time. The muscles, yes, the gap in the muscle's gone, but
Totally.
it's also super deconditioned. And not only that, everything around it's deconditioned. Like
The whole chain.
the whole chain, the whole body is deconditioned. So yes, the local tissue, but you got to start loading the system again. And that's what
Yeah,
people
totally.
forget. It's a system of systems. It's not just change out the part and then you're good to go. It's heal the part and then retrain the entire system to work together again. And that's
Es-
oftentimes the slow part.
Especially if someone's been sedentary for the 4 months prior.
I want to take a quick break from today's episode to share something I believe every rehab and performance professional should know about. For years, I saw too many clients go through the same cycle: short-term fixes, temporary relief, and then the same issues coming back again. That's why I built the Advanced Movement Therapist certification. It's not just another course, it's a system that helps you identify the real cause of a client's pain, give them results that actually last, and stand out in a crowded industry. You'll get practical tools and strategies that you can take straight into your sessions so you can help people get better faster. If you're ready to become the go-to clinician in your community, head to amtcertified.ca to learn more. That's amtcertified.ca. Your clients will thank you. Yeah. And that's why prehab is so important. People come in, well, I'm going to wait till after surgery. I'm like, look, you're going to be if you do nothing for the next 4 months, you're at way lower of a capacity that we have to build back anyway. So
Yeah,
you might as well
totally.
start training everything around it because we're going to have to fix it. And then once you get the surgery, well, now we don't have to worry about everything around it as much anymore. Now we can focus on that one part a little bit more. But yeah,
Totally.
people don't, they think they have this perspective of we're a machine. We're not machines. We're a system that's all integrated, and it has to train
Totally.
up, and it will decondition together, and it will train up and adapt together.
Totally. I think I have one more thing to add to the part that's frustrating
Go for it.
as a therapist is people expecting immediate results after one session.
Ooh, yeah.
That's a tough one.
Yeah.
Yeah. But again, that comes from, okay, this is our initial assessment. Let's set the expectations early. I'm still learning how to do that well as a therapist because it's almost as like, I want to please you. I want you to come back.
Yeah.
But anyways, yeah, work in progress. That's a tough one though.
So,
Or answers right away. Like
right.
first time you've seen me, I have 30 years of chronic low back pain. Why? Like, what's my issue? Give me that answer right now. Like,
Everything I see in front of me right now.
Yeah.
It's all contributing to the problem. So talking about what frustrates you, that's kind of whether, is there anything, coming up newer graduated, anything in the system itself that frustrates you?
This
Regarding
is tricky, and I was thinking,
perspective, assessment.
yeah, I think coming out of school, we almost get taught a lot about, I mean, we do. We get taught a lot about a lot of different things.
Yeah.
Public practice, separate from private practice, but
Yep.
public practice being a big part of that because our education is funded a lot by the BC government
Right.
because there's a need for physios in public practice, which is great. I love that.
Yeah.
It doesn't exist, like public practice does not exist in the town that I live in. And I've inquired in our hospital up here, and it's not a thing. There's one position and it's occupied, and that person is never leaving because it's amazing. Working public practice is amazing. So I think that I didn't feel super well prepared coming into the private practice scene, just because there wasn't enough time in the program, because now it's been condensed because of the pressure from, like, okay, let's cycle grads through to get them into the workforce.
Right.
There wasn't enough time to learn the elements, but also then to string them, okay, how do they work together?
Right.
How do they present? I feel like we did a lot of like diagnostic focus of like, here are your special tests.
Yep.
And then separate from that, it was like, okay, maybe a session every few weeks on like, oh, if someone has, I don't know, limited in this range, what exercise would you provide them? So like very brief and simplistic, but then to get into, yeah, actual private practice. And I think because the colleagues that I work with also are very experienced and really good at what they do, an incredible source of information. Yeah, I think comparing myself to them, I just feel like got work to do.
Oh, we always have work to do. And if you
Yeah,
feel like you're the smartest person in the room, you're in the wrong room. And
totally.
I mean, it's when you're doing something new and you're amongst experts who are just exceptional, like that's probably what some of the most exciting times, because you're like, I get to learn from so many amazing people, and you get to create a process, and you get to see how things work and why they don't work, and create that deeper understanding. I mean, one of the things that I see is, physio school and school in general, they teach you a lot, like you said, diagnostics, the parts, the pieces, the anatomy. They don't teach you how to put it all together. It's like, okay, yeah, they have, you do a shoulder assessment and okay, there's a possible grade 2 supraspinatus tear. You do your empty can test and a few of your other tests, but there's no system to show you why it's there. We're really good at what? There's
Yeah,
no
yeah.
why. And it's because they don't teach us how to look at the body as a system first and then start looking at the parts. They're just like, let's just look at the parts and then figure out how the system works later. But that can be very challenging because we start treating the part, and yeah, it starts to feel better, but then it doesn't get truly better, right? But you, coming from your exercise background, you know how the body works as a system, and you know how important exercise and load is. The other thing is underdosing. Talking about the public sector, it's like, well, okay, we have this injury. Let's try once a week for the next 4 weeks. I tell my students, I'm like, okay, in the 30 minutes that you just saw them, and in the 10,000 minutes in the entire week, how much change are we actually making? And then they don't see change. I'm like, because we're underdosing them. We're not
Yeah,
seeing them
yeah.
frequent enough. We're not loaded. The TheraBand is not enough. You have to load it. You have to load the body and teach them how to load it again to make it feel safe. I mean, if I was teaching in the physio school system, I would just be teaching, let's just look at movement. Can people do these basic movements, and then find out why can't they do these fundamental things, and then get into your special tests. I think it's a little bit backwards right now. They get so focused on the diagnosis, but they don't look at the body first, because
Yeah.
everything is integrated with everything else.
It is. And I was kind of thinking about it too, though. It's like we are a victim of time. Like we can only be taught so much in
True.
28 months of the
Yep.
program kind of thing. And it's like, you got to learn your letters of the alphabet before you can learn words, or,
Mm.
or before you're going
Or
to
and
put
then
those
sentences and then
letters together. Yeah,
paragraphs.
totally, totally.
Yeah.
So it's like, what's the approach that you take? Do you learn sentences before words, or, you know what I mean? Like,
Yeah, I do. Yeah,
it's
that's a
tricky.
good analogy. It is tricky.
Yeah. For me, it's like my thought is like, if I can this is terrible, but if I can understand everything about a system, I guess, like
Yeah.
all the foundation, then I can play around with adding, subtracting, work around with it. But if I don't have those like elementary pieces,
Mm.
then the big picture becomes too overwhelming, that then it's almost like paralysis by analysis. I don't know where to begin, don't know where to start. Um,
That's a good point.
so to take that into, yeah, it is a daunting task to create a curriculum that covers everything that it needs to in all the different fields, and like peds, cardio, breast, neuro, like private practice for sure. It's hard to, maybe it's easy to criticize, but it's hard to implement.
Yeah. No, you're right. Um, yeah, it's almost like they teach us backwards, but then when you get into real world practice, that's why it's so important to find mentorship and so important to
I think
continue
that's
to
it.
educate,
Yeah.
to find
Yeah.
those other systems to help bring it all together to make it
Yeah.
relevant, because all the information's there. It's not really well organized, but being in the
I think
environment you
that's
are,
it.
being it with exceptional clinicians, that will definitely help bring it all together. And I can't emphasize that enough for new grads. You know, the money will come, because oftentimes people can get, well, they're offering me 70% here and this. Okay, great. But do you have mentorship, or are you on your own? You know, because a lot of clinics, it's just like, well, you're getting 70%, but you're responsible for building your own caseload. There's no mentorship. You're just kind of left out into the wind. And if you're not getting results and your schedule's empty, does 70% really matter? That, because your case is empty. So
Totally.
it's I learned early on, I'm like, I didn't care where, like, how much money I was making early on. I just knew I need to get really good really quick. So putting myself and finding mentors and work for the right people, like, that was the thing. And that, I mean, and if you're getting results, now your value's gone up. Well, now you have a full schedule, and now you can make more money because you can charge more for what you do because you're offering a better product.
Do you guys do that? Do you charge more based on credentials, I guess, per
No, we
therapist?
have
Like
we
it's
have a standard fee. I charge more for my assessments. Um, but we have a standard regardless of, there, we tell therapists, especially senior ones who've been doing it, we're like, you can charge more. Like, if you want to make more, you can charge more. And they're like, no, I don't want to do that. Well, that's your choice. That's fine. Like, clinics where you're capped at what you can pay. But I always tell them, I'm like, look, you've got a 4-week waiting list. You can charge another $20 for the initial assessment, or another $10 per session. You can. And if you're providing the value, and if people value you, they won't balk at the price change, because they're probably like, I would probably pay more for this. And for the ones who kind of don't come back in your schedule, but the ones who stay, well, you know who truly values what you do. So as I leave it up to the clinicians. If they feel like they want to charge more, yeah, that's totally fine. You can do it. But as a new grad, I'm like, you have to prove that you can charge more, because you're getting the results and the reputation, and people are talking about you, and you're getting self-referrals. Obviously, you're doing something great. And if you get to that level and you're like, I've got all these credentials and I'm getting the results. Credentials I don't really care about. I care about results. Because you can have clinicians with all these letters at the end of the name, but if they're not getting results and people don't like them because they can't connect with them and they can't communicate, the schedule's empty. I've seen that too.
yeah.
So I always tell people, I'm like, experience doesn't mean effective. It doesn't. Because I've seen very experienced clinicians who are not great at what they do, and their schedules show it. But I've seen 2, 3, 4 year out clinicians, and they got a 4-week waiting list, but they have less experience, but they're getting results. And that's really all people care about is, are you getting me better, and how fast? But that comes with putting time putting time in, getting the reps, getting the practice, questioning, reflecting, I didn't get the results there. What could I do better? But that shows that you care as a clinician, and that's the result of, that's the end result of being a great clinician, is actually caring about the results that you create.
Yeah, totally.
Yeah. What kind of mentorship would accelerate your growth right now? What are you looking for?
Yeah, I'm fortunate I mentioned before, I work with an incredible team of therapists that work for the national teams for
Yep.
Canada Snowboard and Ski Cross, and continue that. And actually, one of my mentors or my main mentor, Therese, who you've
Yep.
worked with, Tom.
Yeah, try very well.
Yeah, she was
Right.
one of my personal physios when I was an
Yep.
athlete, and the three owners of the clinic, they all traveled around with us
Yep.
on our team. So I ask everybody questions all the time, as simple as like, hey, someone's coming in like grade 2 MCL, what brace do you recommend? Point me in the direction, where does it live? Like it can be as basic as that. But yeah, and again, this goes back to, and I've been talking with her too, of like, let's get more into a regular schedule of going over some case studies, popping up with questions. Hey, can I practice techniques on you? And it's all well intentioned, but then the balance of like, okay, I got family, I got these other work commitments. She's got her schedule. Like it's we haven't got there yet, but we're striving towards a better mentee mentorship regularity in scheduling. So that's the vision. And I guess a lot of the mentorship too comes in those impromptu moments as you're like passing clinicians as they're heading into an appointment, you're coming out of one maybe, and just to pick the brain of like, hey, you got 30 seconds, like this is my presentation, or I got this assessment that I'm doing over here, I'm really uncertain of this end feel, can you come give it a feel and tell me your thoughts, whether it's like an ankle, a knee, or whichever. So I guess in those impromptu moments, I'm finding the majority of my mentorship. But I really liked what you said about, physio school is responsible of like, here's the foundation, here are the things to look out for in really serious situations. Like first and foremost, do no harm, be able to identify presentations that are out of our scope of practice, know when to refer on, right? So get us safe in that sense. And then the real learning piece, the next step comes from this mentorship relationship.
Yeah, it's so key. I want to go back to a little bit of mindset. What mindset separates people who come back from injury versus those who plateau?
People that come back from injury and do well versus people that plateau?
Yeah.
I think it's kindness to self. Yeah, I think it's because you can't treat every day the same, because naturally you're going to have these ebbs and flows. So it's being kind to yourself on those days that you're ebbing, I guess, right? A little bit of a harder day. And then when you're flowing, be able to lean into that and be like, okay, I can test where my next level is, or maybe I do a little bit more today. But it's, I think, meeting yourself wherever your body is at that day. For me, coming back from injury and when I had to perform, it was like being willing to commit 100% of whatever your body is providing you with on that day. Does that make sense?
That's such an important point, because people think rehab is linear. Just like athletes think training is linear. Well, I should be able to put 5 pounds on the bar every single week. That's not how this works. You're gonna get this. All right, I can ramp up, and then I need a plateau. I need a deload day or a deload week, and then you can build on top of that. And people, it's undulating. And some days are going to be amazing, and other days you're going to feel like complete crap. But what people need to understand is, on the days you feel like crap, you can still do stuff.
Still can show up.
You can still show up.
Yeah.
Okay, great. We can't put weights on the bar today. Maybe we do some ground flows. Maybe we do some balance work. Maybe we do some agility. Maybe we do something fun to kind of get the psychology and just the brain working, and we don't punish the body so much today. And take those times to. I love what you said of, being kind to your body and just go with it. You know, it's not a setback. It's a slight pause. And that's
Yeah.
okay because neurologically, structurally, things just need a little bit more time on certain days to kind of recover from the stress before, because it's all stress. And if you didn't sleep, if you had a fight with your spouse, training might not be that great that day because your stress cup got a little full. And yeah, it wasn't physical stress, but regardless, the body's in a state of stress, and training is stress. And if you didn't sleep, there's no point in stressing the body anymore that day. Let's just do some recovery stuff to let the body get back to a state of equilibrium or feeling good and safe. And then the next day we'll crush it. But yeah, that's a key thing. And I think that's part of setting the expectations with our clients and our athletes of like, every day is not going to be amazing. You can't keep putting more weight on the bar every single time. That's just not how it works. Or else you'd have a 90-year-old athlete who's the world's strongest person. Not how it works. And we're going to feel a little tweaky here and there. And then we have to be like, all right, why do we feel tweaky? Oh, you know what? We created a little imbalance because we slept awkward today. So now we just have to unwind the system a little bit. Yeah, that's such a, I love that. That was great. Is the commentary fun?
It is. Commentating for ski cross World Cup races and the Olympics is tons of fun. And the part I love most about it, other than it makes me feel like a racehorse commentator, coming around the bend, and there's a pass. It lets me share the athlete's stories.
Oh.
You know, and it's that piece that I think that draws people into sport. And I think that's why the Olympics are such a highlight, is because we do a really good job of sharing those athlete stories and what they've overcome. And then people are like, oh my God, I can relate to this person who on TV looks like a machine, you know, but they're a natural person just like me. And they've gone through these adversities and then they've had these setbacks. And here they are living in their best dream despite having experienced all these challenges. And I think that that's what I love most about it. And keeping my finger on the pulse. I love that. Yeah. Keeping my finger on the pulse in a world that I used to be involved in. Now
well, you do such a great job. I love listening to you commentate. You're a lot of fun, and you got a lot of energy, and you can tell that you love it. And you do a great job. 10 years from now, where do you see yourself? I know it sounds like a job interview, but I'm curious, looking forward, where do you see 10 years now?
Yeah, I hopefully my child is in school and we have some sort of childcare, because right now it's a 2.5-year waiting list before we can get anywhere, so it's tough. That's a big time limiting factor, is childcare. But 10 years, I think, I mean, still being physio, still progressing what I know. Hopefully being able to give back into the profession more than right now. I'm very like absorb, take, right? Yep. Which is fair. I consider myself a new grad. I'll probably be in that standing for a number of years, just the way I feel. But what else? 10 years. So how old am I now? I don't even know how old I am. I'm 36 or 37. I'm 36, I think. So 46. What else? I'm not sure. I probably shouldn't be commentating at 46 anymore. I think that someone more fresh out of the sport should do it.
I don't think it's going to change that
at that point. But yeah, what else? I don't know. We're realizing how necessary it is to go on family vacations every year, and I'm really valuing that now too, as like, okay, I need to book time off work during these times to make sure I'm taking like a week or 2 weeks off just to reboot the system. Yep. And trying to integrate that. But I think, the education piece is just a continued learning journey through life that never stops. Whether you're 1 year out of school or 20 years out of school, it's always striving to be able to show up a little bit better than you were the day before. What that looks like in terms of what else is going on, who knows? Maybe I'll have 2 jobs instead of 5 jobs, but
cut it down.
Yeah.
Well, I mean, that's what makes the profession so fun, is there's so much to learn, and the scope of practice is so broad. We can incorporate so many different things. And I think that
Totally.
for me, that's what's created a lot of longevity in it is you can do acupuncture and dry needling and manipulation, like and fascial work, and you can learn osteopathic techniques, and you can integrate so many different things, which makes it creating having that curiosity and that mindset of I want to continue to learn. It just continues to create that excitement and refreshes. I know every time I went to a conference or a course, I had this new vigor about what I was doing. I was so excited. I'm like, I've
Yeah,
learned this new
totally.
thing. I get to experiment and I get to apply it. I want to see how it affects and the changes we can make. That's the fun part about what we do. And then now where I am, it's now giving back. I love teaching. I love, giving back. And then when we're going over a case study and something just clicks, I was like, yeah, there it is.
Mm-hmm.
It's so awesome.
Totally. Oh, that's good. Yeah,
Yeah.
that's great. It's a beautiful gift, isn't it, to be able to give back, to share what you've learned
Yeah.
through all of your experiences, and even the ability for you to package it into a digestible course and then deliver that to others. I think it's incredible. It's wonderful.
I mean, the main goal, I just want to make it easier. There's the difference between a villain and a hero is they both experience the same pain. The hero wants nobody else to experience what they experienced and go through the suffering, and a villain wants everybody to suffer, right? That mindset of, well, I did it, you have to struggle too. And I'm like,
Mm-hmm.
I don't want you to struggle. I want you to make your own mistakes and don't make the same ones I did. And that's the fun part is I want to see how other people around me now can keep elevating and building on top of everything that I'm trying to share. But like let's just keep leveling this up and put out a better product for people so that we can get them out of pain and moving better and performing at their best. Like that, I mean, that's where I'm at. But if you were to give one piece of advice, to two different people, an athlete getting into sport, especially moving into competitive sport where it becomes their life, and as well as the new healthcare provider coming out of school. Two different people. What one piece of advice would you give to each?
Okay, let's see if the answers differ.
Yeah,
Uh,
maybe they won't.
so the athlete person, I think that you need to know where you want to go and know your reason why you want to get there, and then be persistent. That is my kind of three pieces of advice, and that's what really helped me get to my top level in sport, I think. Because when the days get tough and you need a little bit of self-convincing, being solid in your reason why you want to do it, whatever it is for you, and it's going to be different for every person, or maybe it's the same. It that's what's going to hold you to those days when it's difficult. And whether it's difficult because your body's sore, you're tired, or you're just like lacking motivation, you don't really want to be there. If your why is there and solid, it makes those days easier, I'd say. And then for the new grad coming into the workforce for the first time, don't be overconfident in everything that you've just learned at school. Like, oh my gosh, like a 5-minute OSCE scenario is nothing like the real world. So yeah, don't be naive in that sense. Like, appreciate what you've learned, but also realize that there is so much more to know, and that every interaction is a learning opportunity. And it's okay to be learning in front of a client. I think that's okay. Like, and I really liked what you said before, Tom, I can't remember if you were recording this yet, but talking about the client that you saw this morning, and you go in there with a blank slate, you know nothing about this person, but you're going to do your initial assessment on them the same way you would anyone else, and then you're unbiased going in there, right? So I think for us as new grads, it's like, don't take the shortcuts. Do your scans, do them well, get your foundations in there, and then yeah, don't be afraid to realize that there's so much more learning that's going to happen, and it can happen formally and it can happen informally, and just be open to all of those moments.
That's awesome. That's great advice. Where can people find you, my dear?
They can find me on Easy Street. No, I'm just kidding. I am on Instagram at Kelsey Serwa, KelseySerwa. That's really it. I don't Twitter. I don't X. I don't TikTok. I don't do those ones. I'm not on YouTube. You can follow my husband. He's on the YouTube.
Now your husband's got some beauty videos.
Yeah. If you're looking for entertainment, I'm really just on Instagram and Facebook.
That's awesome.
Yeah. And I'm in the clinic at Back in Action.
Yeah, so go see me
Whistler.
there if you're in the Whistler area. Well,
And if you're an injured worker, come in and see me in the gym.
exactly. And Kelsey would put you through your paces and turn you into an Olympic athlete, just like
There
that.
you go. In 6 weeks.
In 6 the speed program. That's awesome.
Oh my gosh.
I'm grateful for us meeting and working together. You know, you've come such a long way in your career. I'm proud of you. You should be proud of yourself.
Thanks,
and
Tom.
I appreciate you. So thank you for coming on the show.
Yeah, I appreciate you too, and thanks for having these conversations, and taking the experienced along with the inexperienced, and we all got a little something to give in different times in our lives, right? So thanks for providing us with a platform. Thanks for sharing your knowledge, and being the big muscly guy that can still move really well.
I can still backflip. I'm still good.
Yeah.
46-year-old. All right, my dear. We'll talk to you soon. Thanks for coming on.
Okay. Take
Bye,
care.
Kelsey.
Bye.
Thanks for listening to this episode of Staying Relevant. If you enjoyed it, check out the AMT certification at amtcertified.ca, where we help clinicians and coaches get better results faster. Don't forget to subscribe for more episodes and share this with a coach, clinician, or athlete who needs to hear it. Until next time, keep learning, keep growing, and keep staying relevant.